I would first put money into all of the small practices, all of the primary care places, all those places that are just drowning because all the office admin burnout, all that overload. And if you can't get paid out for services that you're rendering at a small practice, it's really hard to stay open. You know what those smaller practices, at least for in my sister's case, she works in Norwell, Massachusetts, and all of her patients that come to her know her personally. And I know, and I don't know if you've dealt with this, I'm sure you have, Nurse Rosa. When you're a nurse and you have that personal relationship, you really, really care. So when things happen where things aren't going well in a practice or whatever, and I'm not saying this is my sister's, but just in general,
Mhm.
it's really, really upsetting that you can't help that patient. It's not even about your practice, it's about your patients. Going through the head of these primary care practice owners that aren't able to serve is very sad to me. So I would just take all that money and pour it back into the primary care physician offices.
Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by Tim Boyle. He is coming to us representing REVA Global. Did I say that right?
REVA Global Medical, yeah.
REVA Global. And he has a really great personal story that I'm really looking forward to hearing more about. For one thing, you and I have a lot in common because we're both from big families. So
hmm
I'm the oldest of six. And how many kids are in your family that you grew up in?
The baker's dozen. We got 13 in our family here. Yeah.
And then tell us where you are in that lineup.
I'm one of the babies. I'm number 11 of 13. So thank goodness they did it.
They didn't quit. So, and then you went into hockey before healthcare, right?
Yeah, we're a big hockey family. We're from south of Boston, a town called Hingham. And in the Massachusetts slash Boston area is very big on their ice hockey. And my older brother played in the NHL for 15 years, and he's 8 years older than I am. So I obviously was wanting to be just like older bro and followed in the same footsteps as he did.
So how did that go for you? I don't follow hockey. Are you super famous in hockey world?
I am not. No, I was what they like to call a bruiser and a suitcase at the same time. I was a fourth round draft pick to the Ottawa Senators. And then I bounced around the minor leagues for quite a while. I didn't have the repertoire or the resume that my brother had with the
Oh, okay.
15 years in the NHL, but I made my way around. I enjoyed it while I could.
Did that mean you got to hang out with him more or play against him ever? How did that work?
He had, yeah, he had 8 years on me, so he's 8 years older than I am. So he's one of the front of the line, and I'm one of the end of the line. So it was more so like a mentor and what you should and shouldn't do. Although I didn't listen as much as I probably should have. Otherwise, I would be 15 years in the NHL like he is. But no,
Right.
he was the best for me as a one, a friend, but two, a mentor, and just a career, like just showing me what the do's and don'ts are for your career. So it was good to have him while I was young, obviously coming
Right.
up in the hockey world, which isn't easy.
Okay, so then how did you drag yourself out of hockey into the healthcare world?
So we, like I told you earlier, the one of 13. We have our oldest sister is actually a doctor. She has a primary care practice, yeah, in Hanover, Massachusetts, with her husband Alan, who's also a doctor. So, and she's our, like I said, and I know you're the matriarch, as you told me earlier before we started recording, but she's our matriarch, and she's always like serving is something that we do in our family as like just as siblings. And when she obviously went to college, she went to MIT. When she graduated from MIT, she knew that she wanted to serve. She's been serving her whole life. I mean, come on, she was taking care of kids since she was probably 12 years old. But that's kind of the will that she instilled on all of us. Like, we're not chasing dollars as a family. We're trying to serve. And no matter what you do, make sure you're serving or doing everything you can to be that best version of yourself. So that's what got me into the medical world. I was playing hockey. I ended up, and I don't want to just keep rambling on, so we can turn this into a little bit of conversation. But I was playing hockey. I got injured pretty badly out in Boise, Idaho, and I was in a hospital bed for 3 days. So I herniated L3 to L5, cracked my S1 in half. Yeah. So
Oh, ow.
yeah, it was no fun. Yeah, and I was there, and I had to go through a rehab process. Thank God it was at like the end of the season. So through the rehab process in the summer, I was going to PT every day, and I was trying to do everything I could to try to make my back better, get ready for the next season. And it honestly, it didn't get any better. It almost got worse as I was trying to do that, trying to push myself. And I kind of had to make the decision that it just wasn't going to work out for me anymore. But during that time, which is the kind of light at the end of the tunnel for me, there was a woman, and my father, I'm going to ramble a little bit here. My father was given 6 months to live and beat it.
They
So
gave
we're,
'em 6 months?
and they gave him 6 months to live and beat it.
Wow.
Goes around, and his job now is he goes around and talks to people and tries to instill faith, instill just motivation in them to just keep going. And for me, I was lucky to benefit from that because he met a woman named Duncan Finnegan who worked at a company called UFOs, who provided me with a therapy sandal that helped my back. I'm not going to get into the weeds with it, but that's pretty much what it did. And when I was wearing it through the PT, it took I did this for, like I told you, I did it for like 6 months trying to get back for that next season. I
Yeah.
wore these sandals for 2 weeks and I felt like unbelievable. And
Wow.
yeah, it's crazy.
Is it just I thought they were like shoes you wear in the hospital. They're sandals?
The same things. Yeah, no, they have the shoes. They with I don't know. It's been a while since I've been there. They have they're closed toe shoes, but hospitals, nurses, especially nurses, if you're
Yeah.
on your feet 8, 10 hours a day, they're really good for it. I know I'm not selling for them, but I do really like the product.
It's your hey, it's your story, man. I mean, what
Yeah,
has more right to tell something than somebody who experienced it, right?
right.
And it's
Hmm.
even better if you're not getting paid to say anything about it
Exactly. Yeah.
'cause it's
So
for
so I hope they send me a few pairs of them for free. And
that
that's
will wear them, right?
yeah, I will wear them though. That's for sure. But
Okay.
so then when I was working for them, I realized that this was what I wanted to do. Like I wanted to help people, I wanted to serve, and I knew that my relationship and my personality was kind of like my moneymaker, I guess. It was what I was good at. And I didn't, being a hockey player, as a hockey player, all you know is hockey. All you want to do is play hockey every single day. You want to go to the rink and you have an agenda, which is very difficult to understand what you can do outside of hockey. You're kind of in a cocoon, you're in your own bubble. So this was a saving grace for me to have this UFOs thing come up and my dad to introduce me to Duncan. But I realized that I wanted to do something a little bit more than selling, and I'm not like, they're unbelievable, like I told you. But at the end
Yeah.
of the day, I was selling footwear, and I wanted to expand it into that medical practice and really be a servant like I could. So I got into the technology space. So I went to a place called Front Runner, and we were selling reimbursement software and registration software to labs and hospitals. And it was really during that time of COVID where like you would have all those people that would have to get tested, and they were pretty much working off of paper rec forms. So it was just taking forever and they weren't able to get things done.
Yeah.
And it was awesome for me, but it was behind a computer. So then I wanted to be face to face, really make the interactions with the doctors, the CEOs of labs, hospitals. And I went over to Perk and Elmer and got a call from Bob, who owns REVA Global Medical. And I'm going to shorten this story. I'm sorry. So
You're fine. Tell me your story.
yeah, so then I got a call from Bob, who's also a professional hockey player. He went to BU,
What?
played college hockey at Boston University, which is
Did
impressive.
you guys play together or against each other ever?
No, he's older than me, but obviously the hockey world's very tight knit. So he knew who I was coming in. He knew my background, and he gave me a call just pitching what he did for the med side, and he knew my experience. And after a short conversation, I was all in, knowing what we could do for hospitals, healthcare spaces. He's
Mhm.
got a pretty good gig over here, and I was all on board to jump on.
That's awesome. So, what challenge or issue are you working to address with Reva then?
For sure. So first of all, we talk to every single one of our clients differently. Although, as you know, many hospital healthcare spaces, even dental practices, will have similar workflows where you get the patient intake, you got to do the reimbursement, or got to do the insurance discovery, then you got to do the back end billing and the patient communication. So there's 4 steps to everything. We like to talk to each of our practices and see where the biggest bottlenecks are. What I've realized from being in healthcare that a lot of the bottlenecks come from the front end. So when you're registering a patient, if they don't have correct information, whether it be demographic or insurance information, you're going to have to deal with that stuff along the line and in the back end, whether it
Mhm.
be insurance verification because they didn't come in as eligible and you had to find the right insurance for them, or for those ones that you had to write off, someone to handle that back end billing before timely filings up. So there's a lot of bottlenecks within the hospital workflow. We can sit anywhere as a medically trained virtual professional. And what we do is we're taking it out of house. We're not in house, of course, because we're virtual. We have medically trained professionals from the Philippines that are able to do any of the tasks that office admins can do, and we're able to do it for a fraction of the price. So we're able to take down those bottlenecks, cut costs, and increase revenue.
And then how are you able to do that at a fraction of the price, like, as opposed to having people in the continental US to
Yeah,
make
yeah,
these
sure.
calls and be virtual assistants? Like, are you offshoring jobs? Like, how does that work?
That's a good question. And so what we would like, and obviously from state to state, it will vary what an office admin will make and what you will have to pay an office admin. But we will charge $12 an hour for our VAs, where it usually is like $70,000 roughly if we're averaging all the states together for an office admin to be in office. So we're saving the place $40,000 roughly 1 year. I personally think it's important to have a face of contact. So when you walk into a doctor's office, I think it's very important to greet someone and say hello and really have a conversation and emotional, as you probably do, right? But
Mhm.
everyone else that's working that office admin staff or the doctors that have to help the office admins, that those tasks, those clerical tasks, so I look
Yeah.
at it as clerical versus clinical. The
Mhm.
clerical tasks that you're having doctors have to fill in to help for, or nurses have to fill in to help for, whether it's chasing down patient insurance or talking to, that should be done by not someone that's went to 8 years of school to have to study patients. So
Yeah.
I believe that nurses and doctors should do all clinical, and office
Hallelujah.
admin should do the clerical. And obviously, with how rising healthcare costs, it's tough to pay for 4 or 5 different admins. So
Yeah.
that's where we came up with this idea of the medical virtual professional.
And how does that work out for them in the Philippines? Is that a good job for them among
It's
their options?
Yeah, so the money is yeah, it's a very good job. We actually have some registered nurses that work for us as MVPs because of the increase in pay that they were actually receiving, which is great. That being said, we vet out. It's hard for a medically trained virtual professional to land a gig with us because we like that vet. We vet them out pretty good. For every 100 that we interview, we will vet out and we will accept 5 of them. So we have a 5% rate because obviously you need to be able to handle EMRs and EHRs. You need to be able to communicate back and forth with the patient. But the biggest thing that we do at REVA is the the communication aspect between patient and VA. So they speak perfect English, they speak great English, they can conversate well, but they also have a great understanding of the medical field and EMRs and EHRs. So that's tough to find for people. I mean, for us, it's tough to find. It takes us a large vetting out process, but it's worth it because what they bring to the medical field is very inf- uh, it's efficient and not influential. What's the word I'm looking for? It's beneficial. There it is.
Yeah. Well, some of the best nurses I ever worked with are from the Philippines. And I know a lot of them would talk about sending money back home.
Mhm.
And then would, have to save up to make a long journey home to see their families. So if it lets them be able to stay there and work, then and still be able to provide their like medical expertise, like you were talking about, that does sound like a really good idea. And right, they speak Tagalog as well, but they
Yeah.
also, like you said, were completely fluent in English as well, and it was always really easy to communicate, I thought. Um, so that's really good to know. And
Another thing I'll add to that, if you don't mind, really quick, we also are big on the home setting. So we have everybody work from home. It's not like they're calling from one spot or a call center or anything like that. We have all of our MVPs work from home at a home setting where they're behind their own doors. It's quiet, and you'll be able to hear and really conversate with everybody. And that's been very important for our current clients.
And they do say that people who work from home are oftentimes have better like mental health. I don't relate to that because I
Not
am
neither
such
do
a person. I think people and like if I'm working from home and my kids and my husband are not there, I get really lonely and I might need to go to
Mhm.
Target to make eye contact with somebody. But
Yeah.
on my lunch break,
My wife's the same way. She
yeah.
loves Target. Uh,
Yeah. Hey, well, and their employees are really nice about eye contact, so at least in my neighborhood. But,
yeah.
um but yeah, so I think it's really great to have the virtual assistants who are humans as well. Like, if you've seen any or listened to any episode of this podcast, you know that I love the
Oh, yeah.
idea of AI and training it to be helpful, but there is a lot that it cannot do. And right now, the clerical work, like you were talking about, is so convoluted and confusing, and people have extenuating circumstances that they need real humans to understand.
Yeah.
So I could definitely value the, human need there. So, but this brings us to my $1 billion question, which is
My
not about
favorite one.
yes, which is not
Yeah.
about a business model. It's more from a philanthropy aspect of like that giving side we were talking about. So
Mhm.
if you, Tim, were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
So I'm gonna give you a two-part answer here because obviously, as I talked to you, I'm one of 13. And I'm the most loyal as it gets, and I'm going to talk family over everything, right? So I would first put money into all of the small practices, all of the primary care places, all those places that are just drowning because all of the office admin burnout, all that overload. And if you can't get paid out for services that you're rendering at a small practice, it's really hard to stay open. So I'd
Right.
take that $1 billion and I'd go across the country and I'd just spread it out. And I'd give it to every single little small practice that's really struggling to even keep the doors open because you know what those smaller practices, at least for in my sister's case, she works in Norwell, Massachusetts, and all of her patients that come to her know her personally.
Yeah.
And I know, and I don't know if you've dealt with this. I'm sure you have, Nurse Rosa. But when you're a nurse and you have that personal relationship, you really, really care. So when things happen where things aren't going well in a practice or whatever, and I'm not saying this is my sister's, but just in general,
Mhm.
it's really, really upsetting that you can't help that patient. It's not even about your practice; it's about your patient. So like going through the head of these primary care practice owners that aren't able to serve is very sad to me. So I would just take all that money and pour it back into the primary care physician offices. If I'm going to talk about REVA Global Medical, then let's talk about REVA Global Medical. I would take all that money and I would provide an MVP to the bigger hospitals. And I would show the value of what an MVP can do. If I got to give them a month free, 2 months free, 6 months free, a year free, and we can take all that $1 billion and put it out into the hospital systems to show what these MVPs can do and how much they can save these hospitals, these primary cares, these labs, all of these people money and time and make their workflow more efficient, it's not only going to help these practices, it's going to help the patient experience. And the patient experience is the most important for everybody. I don't care if you're a salesperson, if you're a nurse. Well, nurses and doctors care a lot more than a salesperson like me would. But if you're in the healthcare industry, I hope that you really care about patients and making things better and trying to serve. So if I was given, give me $1 billion, I dare you, I'd throw it right back into that healthcare community.
That is so great to hear. It's great to hear your heart for it, even though you're not a clinician yourself, but
Mhm.
but it's real to you. Like thanks to your family, and then also your own personal lived experience. And I love how you see the big picture solution of it. And there's so many great ideas out there that it's like, but like you said, it's hard to prove it to the people who need to make the decision to purchase it. It's like, though, some of it, like we
That's
see potential, but and they're like, "Well, show me the proof, though." And you're like, "Well, give me the money to show you the proof, and then I'll be happy to do that."
Right, well, even for us, is like it's just getting in front of the person. Once I'm able to preach what, not preach, but like explain what a MVP can do for your business, and we're cutting costs and we're increasing revenue, and I would love to give it to everybody for free, and because everybody would become. It's just it is so efficiency is everything in the healthcare world. And if a nurse is spending any time on clerical work, if a doctor's spending any time on clerical work, that's a problem, in my opinion. So, how can we fix that? That's the question, right?
Exactly, and, hey, I support that mission for real.
Yeah.
I mean, that's the same hope that I have about using AI or any other technology is to increase the human connection factor. Like I said, I will drive for eye contact.
Yeah,
So,
exactly. Mhm.
anything that will increase the human experience, I am definitely a fan. So,
I don't
well,
know.
I'm really excited to get to know you today, Tim, and to hear your story, and, good luck to you. So, I hope it works out.
Thank you so much, Miss Rosa. I appreciate you having me on today.
Yeah, definitely. So, if you've been listening to this episode and you liked what you heard or have thoughts about it, feel free to leave me a comment wherever you're listening or if you're watching on YouTube. And if you know someone else with $1 billion idea of how we can transform healthcare and make better solutions in a sustainable way, send them my information. Let's connect on LinkedIn. Tim, if somebody needs to connect with you, is LinkedIn the best way?
LinkedIn would be the best way. Either REVA Global Medical or myself, Timothy Boyle, on LinkedIn would be the best way to reach me.
All right. And I will put that in the show notes so people can find you. You can
Appreciate
also
that.
follow me on any of the other social medias at Nurse Rosa Speaks. And if you are interested, I do have a book coming out in January. It's called Speak Up, Start Now, as encouragement for nurses to use their voice and their expertise so that we can put more of those solutions into practice by getting our perspective out. So I hope you'll check that out, and I will see you in the next episode.